Welcome back. Thanks for staying with us here on Midday Kentucky. A herniated disc in the spine is actually a common injury for those with an active lifestyle. So today we wanted to bring in Dr. Ron and Dr. Jacob to tell us what you can do if you suffer from a herniated disc. Welcome to the show.
Thank you. Nice to be back.
So I wanted to start with, what is a herniated disc? Because I was surprised in the break to learn that you said some people have had them and you don't even know it.
Yeah, a herniated disc basically is the disc in between your vertebrae, whether it's in your neck, your mid-back, or your lower back, and that disc acts as a cushion in there. And a herniation is kind of a catch-all phrase, and a lot of times for a rupture or a tearing of that disc in between your vertebrae.
And what's the difference between the herniation and maybe a disc bulge? What's that?
What?
A disc bulge is where the disc itself, I should say, is a fluid-filled structure. A lot of people use the analogy of a jelly donut. And when the inside fibers or the inside substance of that donut tears a little bit, then you start to get a little bit of a bulge. A herniation just is more of those fibers tearing, which leads to a larger protrusion back to where things come out of the spine, like nerves and
Okay.
et cetera.
And you said that people can actually have spinal disc disorders, right? What is that?
Disc disorders usually are just either degenerative issues of the disc, again, disc herniations, disc bulges. And those bulges, if you think about them, are kind of like an air bubble in a tire.
Okay.
And then a herniation is something more like the tire that bursts, even though the disc doesn't burst and it doesn't explode, and it doesn't go flat per se. But there's multiple disorders of the spine, but discs are a common one.
So how common is this that we see it, the prevalence of it in someone's neck or back?
They typically start around age 20 in a lot of people, and there's a lot of good research out there that's been around for a while saying that about 29 to 30% of 20-year-olds have disc issues, whether it's disc bulges or disc herniations, and they don't even know that they have it. And that typically grows exponentially with age. So every decade, you see anywhere from 3% to a 10% increase in the amount of people that have them, and again, they're asymptomatic and don't know that they have them.
So let's say we know we have a disc issue. Maybe it's shown on an MRI. That can be pretty scary. And does that necessarily mean surgery?
Absolutely not.
Okay.
A lot of times you'll see on the MRI that there is a bulge there. Some are asymptomatic. You don't really know other than getting the MRI. Others you know because you went and got the MRI because your arm's numb and tingly, especially in the mornings. You have trouble holding things like a coffee cup or a pen. Dexterity starts to decline. But that's when you come see us as a physical therapist, because we can do a lot of tests with you to determine, is this something that we can help you get better with, help resolve those symptoms. I actually had one lady in just not too long ago who told me yesterday she would have already been in surgery if she hadn't come seen us. So.
Wow. So let's talk a little bit more about how you can help people. What can therapy do to kind of cure these symptoms?
Ultimately, after doing a thorough examination to see exactly what it is, and is it something that can be treated conservatively without the need for surgery or injections or some other procedure, after we examine, we will do a series of exercises looking at movements of the spine and whether they increase your symptoms or they decrease your symptoms, and that can be increased symptoms down the arm or leg, or decreased symptoms up the arm and up the leg into the spine. Manual therapy such as dry needling or soft tissue work, cupping, spinal manipulation, believe it or not, for certain disc issues, also play a role at helping to decrease pain quickly, and then the exercise over time, gradually graded and progressive, will help to keep those symptoms at bay and strengthen and protect the area around the disorder.
So is this something where if someone at home knows they have this issue, a herniated disc, and maybe someone has recommended surgery, that you can come and try some non-surgical options with you guys? Is that how it works?
Absolutely. We are very well trained in knowing when we should not be trying conservative treatment as well. So especially if they're on the fence in any way, they should not have any fears of us saying, oh, let's try this, and then they lose several months of this. We'll know fairly quickly if this is something that they need to go see a doctor for, a surgeon for.
So how do they get started? Start by calling to get a consultation? Is that how it works?
Yeah, it's just easy. They can give us a call. They can go on our website. Quick call. We can do a quick consultation or do a full evaluation. If they have some questions before they want to try conservative care, we'll be glad to answer those up front, kind of put anybody's mind at ease and let them know what we know and how we can help them. And if it's something that we can't help, like Jacob said, we we'll refer back out to, another facility, whether it's their physician or orthopedics or neuro. But a lot of times those more advanced surgical procedures should be the last step, and that's
Okay.
that's what we all know to be true now.
Well, we love that you're offering that non-surgical option, but still attacking it conservatively for your patients. We appreciate you guys coming in today.
Thank
Let's
you.
put up
Thank you
all the
very much.
information up on the screen. You can go to their Facebook page, website, give them a call, schedule that consultation. We'll also post this over on our website and Facebook page so our viewers at home can find the links. Thanks, guys.
Thank you.
Thank you.
Well, stay with us. We have your What's Poppin' on the other side of this break.